There are three primary approaches to remove an acoustic neuroma, and here at Mayo Clinic, a neurosurgeon and a neuro-otologist, so a surgeon like me, would be involved in the care of a patient with an acoustic neuroma. The three approaches are the middle fossa, the translabyrinthine, and the retrosigmoid or suboccipital approach. The translabyrinthine approach goes directly through the inner ear. It's the most direct way to get to the tumor, and it has its advantages, but a disadvantage is that you might lose, or you will lose, all the residual hearing that you have in that ear. There are some cases where someone could have a cochlear implant placed at the same time as a translabyrinthine removal of their tumor and still have some hearing function. It would be different than the hearing they were used to, but in general, if we do a translabyrinthine approach, the patient will lose their hearing. The other two approaches, the retrosigmoid and middle fossa approaches, potentially can be performed where the patient still has hearing after surgery, but it does have its advantages and disadvantages depending on the size and location of the tumor. So our decision of which approach to use is based on patient preferences, their goals, their function before surgery, but also a lot about where the tumor is located, how the surgeons feel comfortable approaching it, and then really a discussion with the patient about what they feel is most advantageous for what their goals are. Usually after acoustic neuroma surgery, a patient will be in the hospital 3 to 5 days. A lot of that recovery is just initially making sure that everything is healing appropriately, that there are no problems with your incision, that there are no other complications that are developing right after surgery. But since all the approaches for acoustic neuroma involve usually cutting the balance nerve, the vestibular nerve on that same side, you feel dizzy after surgery. So patients have to recover their balance. They might have some vertigo initially. Once they get back on their feet, their balance improves, they're able to walk around, they're able to do the things they need to do at home to take care of themselves. That's when we can let them leave the hospital, and that usually ends up being 3 to 5 days after. A lot of the care after surgery is really relying on our nursing and physical therapy colleagues to help you regain that balance function, make sure you're functionally ready to go home. The surgeons, they're certainly watching you after surgery. Your neurotologist and neurosurgeon will be checking on you in the hospital, making sure there are no problems with your incision and how you're healing, and there are no other complications developing. But really, it's a lot of supportive care, working with nurses, physical therapists, to get back your functional status. After the initial hospitalization, really a lot of the pain, vertigo, a lot of those things that people associate with surgery, a lot of that's died down quite a bit by the first week or so. After that, it's really getting back to your daily function, so a balance improvement over time is expected. I tell most patients that by about 1 month, they're probably 50% recovered when it comes to their balance. It can take 6 months to get 90 to 100% of the way recovered from their balance loss. For some people, it can take up to a year, though. But that first month is really just getting back to your daily function because of balance limitations. People are able to have a general diet. They're able to interact with people around them. They still have hearing in their other ear. They're still able to communicate. But a lot of it is just getting back to the things you did as far as driving a car, going back to work. Those are the things that happen over that 2 to 4 week time scale. In the long term, people are able to get back to their normal lives after acoustic neuroma surgery. It can take some months, maybe up to a year, for people to fully recover their functional balance, but people are able to get back to all the activities they were previously doing. People have different ways of adjusting to the hearing loss that they might have experienced because of the tumor or because of the treatment. And you can work with us in our department on different hearing rehabilitation options. But as far as balance, headaches, all those kinds of things that people would associate with surgery, that can really get back to a normal level over time. Really, one of the most important parts in the evaluation of someone with an acoustic neuroma is getting to know them, finding out where do they come from, what do they do for a living, what's their family life like, and what are their goals for treatment, what kind of things do they want to get back to after their care for their acoustic neuroma. And so we think about their quality of life. We think about the things that treatment will do to their hearing, due to their balance, and really impact their day-to-day life, and help them work with us to make a decision on what's the best choice for treatment, if any treatment is needed at all.